RNC Chairman Michael Steele. He joins me now live from our Washington studios. Chairman, you never mince words. You heard the president's comments. Your major concerns right now?
My major concerns remain the same. I think tomorrow night the president has an opportunity to come straight to the American people and tell us exactly what's in this plan. How much is it really going to cost us? Are you really going to cut $400 billion from Medicaid and Medicare programs? Are you really going to have to wind up increasing taxes by some $600 billion on small businesses and families? These are CBO's numbers. These are numbers that are coming from think tanks, people who are independently looking at what this plan is all about. And I think, I agree with the president when he says, it's time to come together and do something different. But this isn't the different we want.
What is the different that you want? Tell me what the different is.
Well, the different I want, the different I want, I think we should start by the fact that we need to slow the train down, number one. Why this rush to get a health care bill signed or at least passed before the August recess, number one. Number two, when you talk about bipartisanship, it's hard to be bipartisan when you're not even invited in the room. We are not even taking the suggestions and recommendations of Republicans in the House and Senate and making it a part of the bill. Oh, do you want to do the bill and then get us in the room to just say, well, at least we had you there? That's not the approach I think that the American people want on what is ultimately a fundamental change to the way we do health care in this country, which is needed in terms of addressing the cost and ensuring the uninsured. But the way the administration is going about it, to me, is not appropriate. So the delay action is so that we can be smart about the action we have to take. And the political points, well, right now the DNC is running around, trying to gin up activity around what Senator DeMint said yesterday. Is that how we're going to do the politics here?
But the more you delay, the more we're going into the hole. I mean, something has to be done. I think everybody agrees that it's important to come to some type of decision because we're already struggling enough in this economy, and healthcare is just costing us up the wazoo.
Yeah, but do you know what that wazoo is? Do you know how much that cost is going up the wazoo?
You know what?
No,
far too much to count. Elizabeth Cohen, our senior medical correspondent here. Can we put a number on it, Elizabeth?
We spend 1/6 of our economy on health care, and Mr. Steele knows that. He talked about it at the National Press Club yesterday.
Yeah.
That is a huge amount of money, and Mr. Steele agrees with everybody that should not continue. It's way too much money. But what I thought was interesting at your National Press Club speech, and I've been reading it here, it was a really interesting speech. You didn't say what you would do to solve the problem. You bashed Obama and Pelosi and those folks, but I didn't hear what you would do to solve the problem.
I beg to differ. I beg to differ. I had 2.5 pages of recommendations on what we could do to begin to address the cost issue, which I laid out as the central reason for this crisis right now. Is cost-driven. It's not access. It's not quality. It's cost. And the reality of it is there are 4 or 5 things I could jump right now, from portability to tort reform to creating co-ops to a host of other things that I had spelled out in 2.5 pages in that speech and bullets that tells you exactly what we should be doing and to begin to address the question of cost containment. So, I mean, to sit there and say that I didn't say what we would do, I reflected back to the American people what Republicans in Republicans in the House and Senate have been trying to get the Democrats to pay attention to for the last 4 or 5 months.
When you were asked by someone in the audience, how do you ensure the millions of people who don't have insurance, you said, I'm not a policy person. But what would your idea?
That's not my job. That's why we elected officials who are now trying to deal with this issue, which is, again, to my point, how do you begin to address that issue in 2 weeks' time? It took us 1.5 years to put the Medicaid program into place. We want to fundamentally reorient 1/6 of our economy in 2 weeks. And that makes no logical sense to me.
So, Chairman, you say...
we've got, let me finish my point. We've got policymakers whose job we've elected to do that. My job yesterday was to go out and to try to establish thematically where we think the administration is getting off the track and where we think that we can begin to put in place some necessary reforms that I laid out in there, tort reform, etc., to deal with the cost containment. And that's what the policymakers should then go and take the time between now and the end of the year or beginning of next year to put in place a solid health care plan that includes insurance agencies, doctors, patients, lawyers, and whoever touches this issue, pharmaceutical companies, for example, as well.
But whether government run or private, I mean, no one's going to demand that you go one way or another. You're still going to have a choice.
We don't. Maybe we do. I don't know. We haven't had that debate. I mean, you're talking about the possibility of reorienting 1/6 of our economy with legislators who haven't even read the legislation. I mean, are they going to do the health care what they did with cap and trade? Are we going to get amendments at 4 o'clock in the morning and no one reads them? And then only after the Health and Human Services Department has to begin to implement this craziness, we're going to find out exactly what's in the bill? This is not how you do health care. And it doesn't give comfort to the people of this country to know that this administration is trying to rush through what I think is a very risky experiment on their health care and the cost that they have to pay.
What about health care reform to senior citizens?
Absolutely. Well, look, the Reg D, prescription drug benefit was put in place during the Bush administration. That was a reform. Some agreed with it or didn't agree with it, but there came a consensus, a bipartisan effort to reach that reform. Certainly, as you go forward and you're looking at the weight and the cost of Medicaid and Medicare, not just to seniors but to the poor in this country, that is something else that our legislators have to begin to deal with. Is the administration going to have to make cuts in Medicaid and Medicare? If so, what are they? If so, how deep? And that's something, again, that has not been addressed as part of this overall effort to reform our health care system. There are a lot of seniors who run the risk in a very short time, if we go through with this thing, and I had it happen, someone said it this morning on another program, well, if my 85-year-old grandmother wants a hip replacement, why should we replace her hip? Well, who wants to have that conversation with the 85-year-old grandmother? Do you? Do you want to be the one to tell her you can't because you're too old? Do you want me to tell her that? Do you want the federal government to tell her that? That's a personal decision, and the government should not put itself in a position of dictating to anyone what their health care outcomes are. We can address the cost issues, and there are ways to do that, but we get on this slope of telling people...
When you say that the government's going to tell an 85-year-old grandmother, sorry, you can't have a hip replacement, where is that in the legislation? I mean, where does it say the government's going to tell your grandmother whether or not she can get a hip replacement? I don't see it in either bill.
Oh, yeah, of course you don't. Yeah, there's a little thing called implementation. Have you seen the flow chart that's come up on the bureaucracy that's going to be created? All the various levels of government agencies and entities are going to have a hand in this. How an independent group of people are going to sit back and make decisions about health care coverage? Of course you're not going to spell that out in the legislation, but you can read and know where this thing is going. And the reality of it is part and parcel of what people are talking about, what people are concerned about. So to this point, whether or not it's in the legislation, it is a concern that I've heard and a number of people have heard around the country that needs to get addressed. And I don't think this administration can look the American people in the eye and tell them that 3-4 years down the road that the federal government, very much like it has with Amtrak, set up a monopoly in health care and have the ultimate control of the outcomes of what you get, where you go, and how you receive that health care service.
I want to point out, though, we're still talking about the fact that people will have a choice. They won't be told to go one way or another. Final question. I'm curious.
Can I be honest? I don't know that. I don't know that. I haven't seen the final bill. I don't know that.
Question for you.
You don't either.
What kind of health care do you have?
I have health care through the RNC. But I was a small businessman and had to pay for this myself at one time, so I can tell you from firsthand experience what it's like to be able to go into this market and have to spend over $20,000 a year to provide health care for my family. So I understand the cost side of it.
But are you happy with your health care?
I'm happy with my health care, just like 85% of the American people.
So you're satisfied with your health care?
But I am concerned about the cost, just like I'm sure you are.
I think we're all concerned about it. All right. Any final thoughts,
Elizabeth? That's the bottom line.
I think, you know what, sometimes this comes down to the haves and the have-nots. He just told us he's a have. He's got great health care. What about the people who don't? And that's what health care reform is about, as well as containing costs.
Chairman, final thought.
Million, but that's 47 million out of 310. All right? So don't paint this picture like, America's, 90% of our people don't have health care. That is not the case. We have a small segment of that community, 12 million of whom are illegal immigrants, 10 million of whom or so are qualified for Medicaid and Medicare already but don't know it or have not gotten onto the program. A significant number of our young people. So that 47 million number looks a little bit different when you get behind it and see who those people are and what their situation is.
Chairman, before I let you go, because I'm just curious, Elizabeth and I both were wondering, what type of health insurance do you have? Do you get that through the RNC?
Yep, through my employer.
What company is it?
Blue Cross Blue Shield, I believe.
All right, Chairman Michael Steele.
Or maybe not. I'm not
sure.
I think it's Blue Cross Blue Shield.
You must be.
Yeah.
You must not have gone to the doctor lately. You're in good shape, Chairman.
I haven't had to use the plan too much. Thank goodness. Although there are days in this job.
You're preaching to the choir, my friend. RNC Chairman Michael Steele. Always appreciate your time. It's always interesting. Thank you.
Take care.
Okay. Elizabeth Cohen, thank you so much. All right. My fact checker here. She keeps me honest on all the issues and all the numbers.